Good morning, everyone. By the way, I am Maria Milianes from BS Ed Sockstead. So for today, I will discuss the educational placement and the suggestions for teaching students with hearing impairment in a regular class. So when we say educational placement, it is the overall instructional setting in which the student receives his education, including the special education and related services provided. In deciding the most appropriate special education program for children with hearing impairment, it is significant that we must know the degree and the classification of hearing loss para ma-identify nato kung unsa ang impact ana o unsa ang program and needs na dapat ihatag sa ilaha. So kung ang tao na ay hearing impairment, dili na siya magpasabot na totally wala na jud siya madungog. So there is a degree and classification, and that will be discussed later. So there are other considerations that need attention in the education of students with hearing impairment. So some of them are educational environments, mode of communication, and support services. So the educational environments encompasses learning resources, technology, and modes of learning. While the mode of communication, it can be linguistic or alphabetic, visual, oral, gestural, and spatial. Last is the support services. For instance, counseling for children, parents, and educators. So, kana yung nakita na picture, tawag ana is sign language. So, it is commonly used by people who are deaf. So, it is a way of communicating using hand gestures, movements, body language, and facial expressions. Next will be the guidelines in making decisions about the educational placement based on the degree of hearing loss. So the possible effects and the understanding of speech and language, possible psychosocial impact, and the potential educational needs and programs. First, we have the normal hearing and the degree of hearing loss based on modified pure tone, average 500 to 4,000 Hz. So the possible effects of hearing loss on the understanding of language and speech is that children have better hearing sensitivity than the accepted normal range for adults. So when a child with hearing sensitivity in 10 to 15 do range will detect the complete speech signal at soft conversational levels. Having a normal hearing does not guarantee good ability to discriminate base sa pananalita ng isang tao, most especially those people that has a condition of hearing impairment. Next, we have the minimal or the order line. So dito, yung bata ay nahihirapan na marinig yung mga boses or sounds kapag malabo o di kaya'y nasa malayo yung pinagmula ng boses. So when a teacher is at a distance greater than 3 feet or if the classroom is noisy, especially in grades K to 3, at 15 those students can miss up to 10% of speech signal kung nangingibabaw yung verbal instruction. So the possible psychosocial impact is that the child may be unaware of subtle conversational cues which could cause child to be viewed as inappropriate or awkward. They miss portions of fast-paced peer interactions which could begin to have an impact on socialization and self-concept. They may also have immature behavior at mas napapagod sila kesa sa kanilang mga classmates na may normal hearing. It is because they exert more effort on listening. Potential educational needs and program may benefit from mild gain or low MPO hearing aid or personal FM system dependent on loss configuration. So itong mga devices na ito, nakakatulong ito to reduce background noise and improve the clarity of the voice. It would also benefit from sound field amplification. So itong sound field amplification, it makes the teacher's voice louder. So if classroom is noisy and or reverberant, naririnig pa rin yung boses nila. Favorable setting. may need attention to vocabulary or speech, especially with recurrent. So, itong otitis media history, sila yung mga batang nagka-infect or na-infect yung tenga nila at hindi naagapan or hindi nagamot, kaya naging impaired yung kanilang pandinig. Next is mild. So, a 30D can miss 25 to 40% of speech signal. The degree of difficulty experienced in school will depend upon the noise level in classroom, distance from teacher, and configuration of hearing loss. So, without amplification, the child with 35 to 42 loss may miss at least 50% of class discussion, especially kung yung boses ay malabo o di kaya yung speaker or yung transmitter ay hindi nakatingin doon sa receiver habang siya ay nagsasalita. It will also miss consonants, especially when a high frequency hearing loss is present. Our ears beginning to build with negative impact on self-esteem, as child is accused of hearing when he or she wants to daydreaming or not paying attention. Child begins to lose ability for selective hearing and has increasing difficulty suppressing background noise, which makes the learning environment stressful. So the child is more fatigued than classmates due to listening effort needed. It will benefit from a hearing aid and use of personal FM or sound-filled FM system in the classroom. Needs favorable setting and lighting. Refer to special education for language evaluation and educational follow-up. Needs auditory skill building. May need attention to vocabulary development, articulation or speech reading and or special support in reading and self-esteem. Teacher in service required. Next is moderate. So the child understands conversational speech at the distance of 3 to 5 feet if it is face-to-face, only if structure and vocabulary controlled. So without amplification and amount of speech signal miss can be 50% to 75% with 40 do loss and 80 to 100% with 50 do loss. It is likely to have delayed or defective syntax, limited vocabulary, imperfect speech production, and an atonal voice quality. Often with this degree of hearing loss, naapektuhan yung komunikasyon lalong-lalo na sa pagkikipagkapwa nila sa kanilang mga kaibigan or barkada na may normal hearing, and it becomes increasingly difficult. So with the full-time use of hearing aids or FM systems, the child may be judged as a less competent learner. So there is an increasing impact on self-esteem at maaaring mawala na sila ng pagpapahalaga sa kanilang sarili. Refers to special education for language evaluation and for educational follow-up. Amplification is essential, like hearing aids and FM system. Special education support may be needed, especially for primary children. Attention to oral language development, reading, and written language. Next, we have the moderate to severe. So without amplification, conversational must be very loud to understood. So a 55D loss can cause child to miss up to 100% of speech information. So it will have marked difficulty in school situations requiring verbal communication in both one-to-one and group situations, delayed language syntax, reduced speech intelligibility, and atonal voice quality likely. Full-time use of hearing aids or FM system may result in child being judged by both peers and adults as a less competent learner, resulting in poorer self-concept, social maturity, and sense of rejection. In service to address these attitudes may be helpful. Full-time use of amplification is essential. Will need resource teacher or special class depending on magnitude of language delay. May require special help in all language skills, vocabulary grammar, pragmatics as well as reading and writing in service of mainstream teachers required. Severe. So, without amplification may hear loud voices about 1 foot from ear. When amplified optimally, children with hearing ability of 92 or better should be able to identify environmental sounds and detect all the sounds of speech. If loss is of prelingual onset, oral language and speech may not develop spontaneously or will be severely delayed. If hearing loss is of recent onset, speech is likely to deteriorate with quality becoming atonal. Child may prefer other children with hearing impairment as friends and playmates. They may further isolate the child from the mainstream. However, these peer relationships may foster improved self-concept and a sense of cultural identity. May need full-time special oral program for deaf children with emphasis on all auditory language skills, speech reading, concept development, and speech. As loss approaches 80 to 92, may benefit from a total communication approach, especially in the early language learning years. Individual hearing aid or personal FM system is essential. Participation in regular classes as much as beneficial to the students in service of mainstream teachers is essential. Second to the last is we have profound. So the children are aware of vibrations more than tonal pattern. Many rely on vision rather than hearing as primary avenue for communication and learning. Detection of speech sounds dependent upon loss configuration and use of amplification. Speech and language will not develop spontaneously and is likely to deteriorate rapidly if hearing loss is of recent onset. So, depending on auditory or oral competence, peer use of sign language, parental attitude, child may or may not increasingly prefer association with the deaf culture. So, the child may need special program for deaf children with emphasis in all language skills and academic areas. Program needs specialized supervision and comprehensive support services. Early use of amplification likely to help if part of an intensive training program. Lastly, we have the unilateral, one normal hearing ear and one ear with at least a permanent mild hearing loss. So, dito yung bata nahihirapan na marinig yung mga boses or sounds kapag malabo o di kaya nasa malayo yung pinagmula ng boses. Nahihirapan din sila na ilocate kung saan nanggaling yung mga voice or sounds na kanilang naririnig. They will also have a greater difficulty on understanding speech when the environment is noisy and or reverberant. Difficulty detecting or understanding soft speech from side of bad ear, especially in a group discussion. So the child may be accused of selective hearing due to discrepancies in speech understanding in quiet versus noise. The child may be more fatigued in classroom setting due to greater effort needed to listen evident. So the child benefit from personal FM or sound field FM system in classroom. Cross hearing aid may be of benefit in quiet settings, needs favorable setting and lighting. Student is at risk for educational difficulties. Educational monitoring warranted with support services provided as soon as difficulties appear. Teacher in service is beneficial. Educational placement. In the Philippines, students with hearing impairment, like other students with disabilities, are mainstreamed in regular classes either on full-time or part-time basis. A special education teacher assists the regular teacher in seeing to it that the students receive as much instruction as their hearing classmates. Some special education programs employ an interpreter in the regular class who translates the verbal activities into signs and gestures to enable the students to follow the lesson. The special education teacher gives special instruction in the resource room or in the special education center on oral or total communication, manual communication that includes finger spelling and different sign systems, auditory verbal training, and cued speech. Support services. Communication accessibility is provided by sign language and oral interpreters inside and outside of the classrooms. Computer-aided instructions or CAI reinforces the knowledge and skills in the different subject areas. The special learning areas like speech, auditory training, and language are taught effectively through computer-aided instruction. Some TV programs and videos utilize closed captioning services in sign language that make the programs accessible to individuals with hearing impairment. So we are on the suggestions for teaching students with hearing impairment in a regular class. So it is significant that we know and learn these lessons for us to be able to know how to deal and handle the students with hearing impairment. So first, we need to promote the acceptance of the students with hearing impairment in a regular class. Welcome the students to your class, explain the students' conditions to the entire class, emphasize that he or she can learn together with the hearing students. Make modifications in teaching as natural as possible. Accept the students as an individual with abilities and limitations. Discuss the students' conditions with him or her. So, kani nga suggestions makatabang ni siya to prevent judgment or discrimination. And then, aron pud ma-feel sa kabata nga na ay hearing impairment na dili siya behind or less competent. And it can also help to boost confidence. Second, be sure that prescribed hearing aids and other amplification devices are used. So it is important nga permanently jud ginagamit ang mga amplification devices for them to be able to understand the voices and the sounds. And it is also significant that we explain to the class that the hearing aid makes sound louder but not necessarily clearer. So there are times nga dili maklaro sa usa ka bata nga naay hearing impairment ang voices or sounds. So there are instances nga mangutan na silahang classmates or they seek help. Then it is important to the class for them to be able to know what's the situation is going on. So next, I will discuss the educational approaches used when working with students with hearing impairments. So first, we have the bilingual, bicultural. So in basic position, considers American Sign Language or ASL to be the natural language of the deaf culture and urges recognitions of ASL as a primary language choice with English considered a second language. Objective: to provide a foundation in the use of ASL with its unique vocabulary and syntax rules. ESL instructions provided for English vocabulary and syntax rules. Method of communication: ASL or American Sign Language. Second, we have the total communication. Basic position: it supports the belief that simultaneous use of multiple communication techniques enhances an individual's ability to communicate, comprehend, and learn. Objective: to provide a multifaceted approach to communication to facilitate whichever method works best for each individual. Method of communication: combination of sign language accepts the use of any of the sign language system, finger spelling, and speech reading. So the third one, basic position, supports the belief that children with hearing impairments can develop listening, receptive language, and oral language expression. English skills emphasize use of residual hearing, the level of hearing an individual possesses. Amplification, hearing aids, auditory training, and speech language training. Objective: to facilitate the development of spoken or oral English. Method of communication: spoken or oral English. Additional suggestions for teaching students with hearing impairment in a regular class is that the special education teacher should check the student's hearing aid or other devices and that they are working properly. Encourage the students to take care of his or her hearing aid and to tell the teacher when it is not functioning properly. Be sure your student has a spare battery at school. Tell the special education teacher or the parents if the student's hearing aid is not working properly. Third, provide preferential seating. Sit the students near the spot where you typically stay when teaching. Sit the students where he or she can easily watch your face without straining to look up. Sit the students away from sources of noise. Sit the students where light is on your face and not in the students' eyes. Fourth, increase visual information. Remember that your students read your lips and must see your face in to do so. Try to stay in one place while talking to the class so the students does not have to lip read moving target. Avoid talking when your back is turned to the class, such as when you are writing on the chalkboard. Avoid covering your mouth and face when
It
talking.
is important to increase
When
visual
reading in front of the
information
class,
for
be sure
the
that the
students
can
be able
lip read
to
you.
understand the message that you are trying to imply and to follow giunsa nimo pagbukas imong ba samtang naga-istorya ka. It is because the students read your lips, and it is one of the ways how the students learned. Next, minimize classroom noise. Sit the students away from noisy parts of the classroom. Wait for the class to be quiet before talking to the students. So it is important as a future teachers nga dapat dili ta mag-discuss kung saba ang environment or saba ang classroom. As what I've said kanina, amplification devices are not necessarily clearer. So, to be sure, dapat dili jud ta mag-discuss kung saba ang palibot aron nasabtan nila kung unsa ang atong mga gipanulti. So, that's all of my report and I hope you have learned something.